Hello everyone, I'm Angry Ravichandran. So today myself and my team members will be talking about infertility. What is infertility? So infertility is a complex medical condition that happens when there is a failure of conceive following a year of regular unprotected sexual intercourse. So it affected millions of couples globally, regardless of age, ethnicity, or even socio-economic conditions. So generally, infertility is common among women, but it also can be affected by men. As for females, the hormone imbalance. As for females, the major causes are hormone imbalances, ovulatory disorders, and anatomical abnormalities are the major common causes. And for the men's, it's basically due to the low sperm count and also the low mortality and genetic flaws. So, as you can see, beyond the medical terms, infertility has been a burden to many of the couples and also a burden on their personal well being. On the other side, there are also a lot of medical advances like assisted reproductive technologies like IVF, which is in vitro fertilization. IVS has given a hope in successful pregnancy, and also despite the barriers that they face like cost, access, and also cultural stigma.
On the risk factors of infertility in both males and females. Infertility is a global health issue that affects couples emotionally, physically, and also socially. So it is really crucial to understand on the risk factors that contributes to the infertility for any prevention and also early intervention. So let's start with male infertility. Risk factors that contributes to the infertility among male, I would say, is varicose. Varicose is shown in the pictures above, which is the abnormal enlargement of the scrotum that can affect the sperm production and also the sperm quality. And then we have infections contributing to the infertility among men as well, as in like mumps affecting the testes, STI that could lead to scarring and also blockage in sperm pathways. Hormonal imbalance also plays an important role in infertility among men. So, such as low testosterone or even pituitary gland issues can also disrupt the sperm development. Ejaculation disorders such as retrograde ejaculation, it also interferes the sperm delivery. And then genetic disorders such as Klinefelter syndrome also contribute as a risk factor for infertility among men as well. To the risk factors that contributes to the infertility among female, we have polycystic ovary syndrome. For short, is PCOS. This is as per shown in this picture above. So it is basically PCOS is basically a hormonal disorder causing irregular ovulation, right? And then we have endometriosis, which is the uterine tissue grows outside the uterus, disrupting the whole reproduction function among female reproductive system. And then premature ovarian insufficiency. This is basically happens before the age of 40. We all know that menopause happens around 40 to above 45 to 50 years old. But when it comes to ovarian insufficiency, this is what contributing to the infertility among female even before they get menopause. And then we have tubal blockages or also damages. Tubal blockages, maybe we can have fallopian tube blockages. This could maybe due to infection, also previous surgeries, or even trauma due to C-sections as well. And then we have uterine abnormalities such as uterine fibroids or even structural defects among female reproductive system. And then thyroid disorders and also hyperprolactinemia. These both can disrupt in menstrual cycle and also ovulation cycle. So for both men and female, right, we have basic uh, or even biological causes, lifestyle, and also environmental factors that can significantly impact fertility in both men and women. So, first of all, we have chemotherapy. Chemotherapy and radiation can also damage reproductive tissue and reduce fertility potential among female. This is really common among female. And then smoking impairs sperm quality in men and also reduces ovarian reserve in women. And then we have obesity. Obesity is basically linked to, as I've already mentioned earlier, hormonal imbalances, menstrual irregularities, and also reduced sperm production among men. Alcohol consumption or drug usage can negatively affect hormonal levels and also gamete quality in both men and women. And exposure to environmental toxins such as industrial chemicals, people working in industrial places, right? Normally among men, that can also damage reproductive cells. And then a usage of anabolic steroids in men that could shrink the testicles and severely reduce sperm production. So, to sum up the risk factors of infertility, right? Infertility is basically multifactorial, involving both physiological and also modifiable lifestyle risk. And in my opinion, awareness and early intervention are essential to preserve fertility and also improve reproductive outcomes.
Yeah, all right, everyone. So let's move on to the next topic, which is the diagnosis of infertility. And I am Fatima Zura, and I will present about infertility, diagnosis on infertility. So, let's begin with define what is infertility. Infertility is typically defined as the inability to conceive after 12 months of regular and protected sexual intercourse. If the female partner is above 35 years of age, investigation usually begin after 6 months due to natural decline in fertility with the age. The first step in diagnosis is a true evaluation of both partners. It's important to note that infertility is not just a female issue. Male factors also contribute to nearly half all cases. For the male partner, the primary diagnostic test is a semen analysis. This assesses sperm count, motility, and morphology. If abnormal, if abnormalities are found, further tests such as hormone profiles and scrotal ultrasound might be recommended. For the female partner, several tests may be done, starting with a review of menstrual history and ovulation. Ovulation can be accessed using methods such as basal body temperature, tracking, ovulation predictor kits, and serum progesterone levels. Okay, next, imaging techniques like transvaginal ultrasound help assess the uterus and ovaries. A procedure called hysterosalpingography or HSG checks whether the fallopian tubes are open and if the uterine cavity is normal. This is crucial since blocked tubes are a common cause of infertility. Tests such as FSH, LH, prolactin, and TSH help identify hormonal imbalance that may affect fertility. In some cases, more advanced testing like laparoscopy might be used to directly view the pelvic organs. To summarize, diagnosing infertility requires a systematic, step-by-step approach involving both partners. Early diagnosis not only helps in identifying the underlying cause, but also increase the chance of successful treatments. That's all from my part for diagnosis the infertility.
Assalamualaikum and warm greetings to Dr. Arfa. Okay, today I will be presenting on the treatment options for infertility in both men and women. Infertility is defined as the inability to conceive after 12 months of regular and protected intercourse. So this treatment depends on the underlying cause and whether the issue lies with the male, female, or both partners. Okay, let's begin with male infertility. Simple lifestyle changes can improve fertility significantly. These include quitting smoking, reducing alcohol intake, avoiding heat exposure such as hot tubs,
managing weight and exercising regularly, and also consuming a diet that rich in antioxidants. When lifestyle modifications are not enough, medical treatments need to be considered. These include hormonal therapy for imbalance, like low testosterone, using drugs like HCG or clomiphene, antibiotics for infections, and anti-inflammatory medication for chronic conditions. Okay, surgical options are also available, such as varicocelectomy to correct the varicocele, vasovasostomy to reverse the vasectomy, and sperm retrieval techniques such as TESA, TESE, or MESA. If the sperm quality or quantity remains low, assisted reproductive technologies like IUI, IVF, and ICSI are often successful. Okay, that's all for male infertility. Now we move on to the female infertility. Moving on to female infertility, lifestyle improvements like achieving a healthy weight and managing stress are very crucial. Medical treatments include ovulation induction using clomiphene, citrate, or letrozole, especially in PCOS, metformin for insulin resistance, and correcting hormonal issues like thyroid disorders. When medical treatments are not effective, surgical options such as laparoscopy, hysteroscopy can be used to treat endometriosis, fibroids, or adhesions. So, by assisted reproductive techniques include IUI for mild cases, IVF for more complex issues like blocked tubes, ICSI when male factors are involved, egg donation for low ovarian reserve, and lastly is surrogacy when pregnancy is not medically feasible for the woman. Lastly, psychological support and genetic counseling play essential roles in the treatment process. Infertility can be emotionally draining, and having access to counseling can improve outcomes and mental health. In conclusion, infertility is a complex issue, but with a combination of medical, surgical, and assisted techniques, many couples can achieve successful pregnancy outcomes. So, thank you for your attention. I'm happy to take any question you may have. Thank you.
For the emotional and psychological impact, infertility often leads to feeling to grief, guilt, especially common in women who may feel their body has failed, and the couples may experience marital strain like communication breakdowns, particularly when they cope differently, sexual dysfunction, emotional exhaustion, or depression. The woman in particular may face social stigma or pressure due to repeated treatment failures. The pressure from family and friends will be the well-meaning but intrusive questions like when are you having a baby can intensify emotional pain, and the cycle of hope and disappointment with each treatment attempt can wear down resilience. So, as a conclusion, in a nutshell, infertility it's not just more than a biological obstacle. It also been a complex medical health condition that can affect the couple or an individual both emotionally and physically. But with increased awareness and also ongoing medical advanced treatments, you can often treat the underlying causes of the infertility and also bring hope where we can advise the couple to get conceive using the IVF like I said before. And also, however, it is also critical to actually address the psychological impact and also the social beliefs of infertility. By creating a supportive environment and increasing the access to reproductive health care, society may help decrease the burden of infertility and empower people on the path to motherhood. That's all from me. Thank you so much.